Good morning. This is Mr. Janosiak, and I'm coming to you from my home. Our last topic for the end of our week about social stratification is about the effects of poverty in the United States and the government response to poverty in the United States. So the lives of poor Americans differ markedly from the lives of society's wealthier members. Poor and wealthy members of society have different life chances and behavior patterns. By life chances, sociologists mean the likelihood that individuals have of sharing in the opportunities and benefits of society. Life chances include such things as health, length of life, housing, and education. Research has shown that life chances vary by social class. The lower their social class, the less opportunity individuals have to share in the benefits of society. Poor Americans are at a serious disadvantage in two important life chances: health and length of life. Rates of heart disease, diabetes, cancer, arthritis, pneumonia, and tuberculosis are highest among those living in poverty. In light of this fact, it is not surprising that poor people have shorter life expectancies than other members of society. Life expectancy refers to the average number of years a person born in a particular year can expect to live. Ooh, you're recording this here. So let's look at life expectancy in US, maybe by social class. Think that'll give us anything? Do, 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 do. I know this is fascinating. You're just looking at the screen and I'm talking. See, I just got out of my office hours and then I went right into this and I apparently did not prepare very well. Okay, so I'm looking at a diagram where life expectancy for the poorest Americans is somewhere around 75 to 76. For the richest Americans, we can even go 84 to like 87. So there's a good decade difference for life expectancy for the very poorest and the very richest. It's a pretty big gap. 10 years is a long time. Two reasons for ill health and shorter life expectancy among poor Americans are inadequate nutrition and less access to medical care. Poor people have less money to spend on food and are often less informed about good nutrition. A lack of money also limits the amounts of health care that poor people receive. A significant number of poor Americans do not have health insurance because it is too expensive. Uninsured people are less likely to get routine physical checkups and other preventive care. They're also more likely to postpone medical treatment and to not fill prescriptions. The environment that poor Americans work and live in has negative effects on health. The working poor often have jobs that involve considerable health and safety risks. The housing that poor people are able to afford is often inadequate and unsafe. As a result, poor children are more likely to be exposed to environmental hazards such as lead paint. You should, of course, for a case study of this, look at Flint, Michigan, currently, where the lead in their water has disproportionately affected poor Americans. Educational opportunities are also limited for poor Americans. School funding is based part on local property taxes. As a result, schools in low income areas are often inadequately funded because of low tax revenues. These limitations negatively affect future life chances. Certain behaviors also vary depending on social class. For example, divorce rates are higher among low income families than among other segments of the population. Poor Americans are also more likely to be arrested, convicted, and sent to prison for crimes than are Americans from higher social classes. This situation results in part from the fact that people living in poverty are more likely to commit crimes that the police pursue more aggressively. Among these are violent crime and crimes against property, such as burglary and auto theft. Because criminals usually commit offenses in or near their own communities, poor people are more likely to be the victims of crime. So now I have kind of run through a bunch of ideas here, but really it kind of lends itself to this idea of the cyclical nature of poverty, where you are born into a poor neighborhood. Well, you are more likely to have health problems, which are expensive. You are more likely to have a poor environment around you, which costs you in your health. Your schools are poorer, which leaves you at a much more disadvantage to leave that poor neighborhood because the schools are poor because of the poor neighborhood. You are more likely to commit crime, where people who are felons then, when they return to their communities, have less access to work and a way to pull themselves out of poverty. In this way, poverty for many millions of Americans is a cyclical process where which really limits the kind of social mobility that we like to imagine in America. Not to say it doesn't exist, but there are lots of factors that people at a disadvantage um, have a hard time leaving because it just drags them back into tough situations. In 1964, President Lyndon B. Johnson declared a war on poverty. Since then, the federal government has taken an active role in attempting to reduce inequality in the United States. The results have been mixed. If you would like more information about Lyndon B. Johnson's approach um, to ending poverty through the power of the federal government, you should look for The Great Society. Almost 46.7 million Americans still live in poverty. In addition, the poverty rate is about the same as it was in the early 1970s. Nevertheless, the situation has improved in some ways. In 1966, for example, poverty among elderly Americans was almost 3 times as high as among the general population. Today, the poverty rate for people 65 and older is lower than the rate for the country as a whole. This improvement is due mainly to increased Social Security benefits and the introduction of Medicare, the government sponsored health insurance program for people 65 and older. With that said, it should trouble you that the level of poverty has remained the same since 50, 60 years ago, where the federal government really started to create huge programs to help the poor, and yet the rate has remained stagnant, a troubling statistic for America. The government tries to reduce inequality through various social welfare programs. These programs use one of two methods: transfer payments or government subsidies. The government uses transfer payments to redistribute money within society by funneling a percentage of tax revenues to groups that need public assistance. These groups include people who are poor, unemployed, elderly, or disabled. The major transfer payment programs include supplemental security income and temporary assistance for needy families. SSI provides income support for people 65 years of age and older, and for blind and disabled adults and children. TANF gives cash payments to poor families with children. I have a graph for you here, okay, just to kind of get a sense of like what these benefits look like. Right, so a monthly kind of paycheck through TANF of about $644 for a family of 3. So this is kind of just some data to look at what this kind of big government program looks like and the amount of assistance that they provide people. And again, when we ever talk about poverty, right, remember $644 for a person living in poverty in a place like Los Angeles. This will not go as far for someone living in a rural area. The second approach used by the government to assist poor Americans is subsidies, which transfer goods and services rather than cash. The food stamp program is perhaps the best known government subsidy. Under this program, poor people receive coupons or cards that can be used to buy food. Other subsidies include those for housing, school, lunches, and Medicaid, a health insurance program for the poor. From the 1980s onward, calls for reform of the social welfare system grew louder. Critics charged that the system had created a permanent welfare class who chose to live off government assistance rather than to work. In 1990, yeah, that's correct. The federal government responded by passing the Personal Responsibility and Work Opportunity Reconciliation Act. This act turned the administration of some welfare programs over to the states. It also changed the rules for payment of assistance. Before, people could receive payments indefinitely. Now, most people receive payments for no more than 5 years and are required to work after 2 years in the program. Just as a commentary here, this debate rages ever onward within the American political system, with the left generally supportive of calling for the expansion of welfare programs to help the needy, and on the other side, the conservative right leaning individuals who argue about that permanent welfare class. There is, again, data to support both sides of the argument, and a robust debate that continues to this day in the American political scene. Some observers have hailed welfare reform as a success, pointing out that it has greatly reduced the number of people on welfare. How well the people who have moved from welfare to work are doing is less clear. However, one study found that nearly a third of those who had left welfare were back on the rolls within 2 years. Those who remained off welfare reported facing considerable economic problems. About half said they sometimes ran out of food and could not afford to buy more. More than a third reported that at least once during the year they could not pay their rent or utility bills. Some observers suggest that such statistics show that the success of welfare reform should be judged as much on income and poverty outcomes as on welfare roll reductions. There you go. That is the content I'm uploading to for the week. It's real awesome. I miss you all. I hope you are staying healthy, and good night.